Okay, good morning to all. Again, this is a free writing session from OET for you. Okay, so so we are going to discuss Martin Wilson's case note in a minute. So it should be like in a discussion form, like you have to. I will ask some questions you have to tell. Then only we can discuss more about the letter. So you got a case note like this in your writing exam. So what you are going to do first? So you got 5 minutes reading time and 40 minutes writing time. So you're going to check what is the writing task assigned to you. Okay, that is the first thing you're going to do. Okay, so you can see that what is the first writing task here. It is given that using the information in the case notes, write a letter to the social worker, Miss Jennifer Adams, at the Elizabeth Community Health Center, 125 Manopara Avenue, Elizabeth 5098, requesting follow-up care. So there is two informations usually in the writing task. That is to whom we are writing. And what is the second one, please? Anyone can tell me. Okay, that's right. So what is the purpose of the letter in this case? Hmm. And what's the exact purpose of the letter in only considering this writing task from here to here? Okay, that's follow-up care. Yes. Mm. So, yeah, but please, what I'm saying is you are looking only the writing task in front of you, you don't know anything about the top of the case note at the moment, is it? You are in an exam hall, so you are reading first time writing task. So if you are doing like that, okay, so see, you can see that you can find there is a follow-up care that is needs to be done, and stress that Mr. Wilson's case needs urgent attention. So this point is very, very important. So you got 3 points from this writing task. One is that you are going to write a letter to the social worker. Okay. The name of the social worker and address is already given. Okay. Second one is follow-up care. Okay. Third one is needs and urgent attention. Okay. Then you ask yourself why the patient need follow-up care. What is the patient's condition? Why patient need urgent attention? Okay. So answer for that question is you have to look and read the case note carefully and find out the answer, and that is your letter. You got the point? Okay. So coming back to that, so the introduction that we discussed yesterday. Some of the candidates are not here. Means if it is, if they're first class, they can. I'm going to record all the sessions from now onwards, and I'm going to provide it into the the WhatsApp group as well. So what I'm going to do is like again we are talking about the introduction one. So introduction should be there should be. So when you see the writing criteria for evaluation criteria for the OET, you can see that. So the purpose of the letter should be immediately apparent and sufficiently expanded. So I don't want you to see below this bar. Okay, that's not for you. That is for less than 350 marks. Okay, only you are concentrating about this part of the writing assessment. Okay, So for the purpose of the document is immediately apparent. So to become immediately apparent, what you need to do, what you need to do, you have to tell that the patient, what is the present complaint of the patient? That should be in the introduction. And what is the purpose of the immediate purpose of the letter? Okay, that is the two important things you have to say in the introduction. Okay, so then we are going to see why we are going to write a letter to the social worker and why the patient need urgent attention and why the patient requires follow-up care. Okay, so for that we have to read from top to bottom. So we have 5 minutes reading time. So quickly we are going to read what is the patient's, or it's given that Lyle McEwen Hospital is the hospital that you are working. Okay. Patient details is Martin Wilson, 62 years of old, and admission date is the discharge date is the diagnosis is already given, and past medical history, social history, and nursing management and discharge plan. So how we are going to write a letter from this case note. So you know only one thing at the moment, that is you are going to write to the social worker, okay, and he needs follow-up care. So when you start reading from the first case note onwards, like this admission date, you should think whether it is relevant, irrelevant, or semi-relevant. Okay, so you should think like that and keep it in your mind. And after the 5 minutes time, you're going to take your pencil and put that this is relevant, this is semi-relevant. You can take, or you can just, yeah, just this one is important, or this one is important, and this one is important. Like that, you can make it a note for that. Okay, so and what you're going to do next is should tell me one by one if you want to participate in this discussion. So like from past medical history onwards, one line per person, tell me whether it is relevant, semi-relevant, or irrelevant for this particular case. Okay, that means heavy smoker, 40 cigarettes per day is relevant. That was your point. Yeah. Okay, next one please. Yes. Not relevant. Okay, let's see. Next one. Yes, of course, it is related to that. Yeah, you can think like that. So you can put it as a semi-relevant if you want. If you are confused with two ideas, like, okay, this is not going to be the exact one, but you can consider it as a semi-relevant point, and you can come back to that later. You can whether you can include it depends on the length of the letter that you are going to write. So you can consider it as a semi-relevant, and we will come back and see that again. Okay. So the first time you can consider it as a semi-relevant. Don't put it as irrelevant because it has some importance because it is a medical condition and abnormal condition of the patient, isn't it? So don't consider it as irrelevant. Consider it as semi-relevant, and we will come back to that. Okay. So next one. Okay. 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 Next one, please. I don't know, please. That's what I need you to tell me. Like, is why it is to whom you are writing. That is important. To think that you are going to write to a yes. Why? Because you're going to write to we were writing to a social worker. So social history is the important thing that you are considering in this letter as the main important point because you're writing to the social worker. So from the social worker thing, I already told you the last class that even if it is written social history, maybe some of the informations are not social history, maybe medical history. So you have to find out and to find out which one is relevant, which one is irrelevant, which one is semi-relevant. And even some of the social histories are not that much relevant. Okay, so you have to read each line and each point carefully and find out whether it is relevant, semi-relevant, or irrelevant. So please tell me the next line. Is anybody else can tell me? That would be highly appreciated. Like retired 2 years ago, bookkeeper with Holden Car Company. Is that the information is a relevant one? Mm-hmm. Okay. So I got all the three options now. So somebody, yeah, why it is relevant, why it is irrelevant depends upon to whom we are writing and what is the patient's condition. So we know the condition of the patient, diagnosis of the patient is attempted suicide. So this also you should keep in mind. We already read that. Okay. So overdose of Mogodol. Okay. So that means something related to after retirement. We don't know yet. We just considered it as semi-relevant. Okay. So because it is social history, isn't it? It is a social history that may be relevant later. So consider it as semi-relevant uh, at present now. So then we will discuss, move on. Then we'll find out whether it is relevant or irrelevant. Okay. So lives with wife Joanne and adult son is housing trust magnate in Elizabeth. Okay, we can mention that. Yeah, that's fine. So move on. Next one. Wife works at calls, son unemployed, two married. Okay. So is considered it as irrelevant? What's your point? Is it irrelevant or semi-relevant? Or what do you want to do that with that particular point? Okay, just consider it as irrelevant at the moment. We can come back and select later as well. Okay, so two married daughters and five grandchildren. Okay, that's fine. Then move on. Regular social drinker. Relevant. Okay. So again, depression related to gambling addiction. Yes. So while you are reading, you may know that in the relevant point, also you have some preferences, isn't it? Priorities. Okay. So you are saying that this depression is important one rather than considering social drinking. Okay. So likewise, you have to think that this got priority and this got little bit less priority. So move on began gambling 2 years ago. So that's also related to gambling. So you can club that information later. So has lost a lot of money, including superannuation fund, and is in debt. So relevant. So it's also so this is all connected points. Yeah. So wife and family previously unaware of addiction, very angry, but also upset about suicide attempt. Okay, relevant. Patient remorseful and ashamed. Is this after or before? Is it after the attempt or before the suicide attempt? This is present condition. The patient is now after the suicide attempt because the patient condition is said that patient had attempted suicide. Okay, so now he is ashamed of what he had done. Okay, so wants to overcome addiction. So the patient has like to overcome addiction. Okay, what addiction they are talking about here? Yes, so this is the one. So that means you have to be careful while selecting and clubbing the informations for that particular thing. Okay, used to be a keen lone ball sprayer. Is that important or not? Yes, and we can use that information, you know, yep, that's right. So later, when we are writing the paragraph, we can use that information, consider it as semi-relevant. Has lost friends as a result of gambling? Yes, of course. Yes. Yes. Okay. Yeah. What you had done with this patient, nursing management. All right. So, because the patient was with you, how many days? Just think about that. 13 October 2009 to 24 October 2009. So that means patient was with you around 10 days. Okay. So in that 10 days, what nursing management you had done? That is in this heading. So you have to tell me which one is important, which one is not important, all that things. Okay. Weak and depressed. Important. Okay. Okay. Mm-hmm. Yes. Okay. That's fine. So another one, diabetes education regarding diet and oral medications. Important. Yep. Wheelchair use from 2010. Okay. Okay. So psoriasis. Okay. So the treatment is diprosone and shampoo, ionl T shampoo and poor appetite, physical unfit. Is that important or not? Okay. So that's fine. Discharge plan. So what is the discharge plan for this patient? Encouragement to maintain antidepressant medication routine as the SSRI is established. Mrs. Wilson will help with the supervision, monthly follow-up appointments with psychologist Dr. Brian Murphy, like Carl McEwen Hospital. That is the hospital you are working as a nurse. So it's already done. So only encouragement to maintain antidepressant medication is important. Okay, then next one. Social worker appointment to be made for gambling addiction therapy? Yes, but that's why we are writing this letter. Okay, so you are writing letter to the this social worker. Okay, and you don't want to mention that. That is the purpose of the letter, but it is important, isn't it? Okay, strong encouragement and assistance to join Gambling Addiction Action Group, Elizabeth Community Center. That's needed. Is because the gambling addiction therapy is. That's why we are going to write this letter. Okay, so contact with Qtline needs to be encouraged. Who will deals with Qtline? Of course, social worker can deal with that because Quitline is a social service. Okay, so social, yes, wheelchair required for another week. Who is going to arrange that wheelchair? So social worker can arrange that. That's what social workers' duties and responsibilities in Western world. Okay, so they can arrange that one as well. Frame advised after this, so you can mention that all important point. Maintain psoriasis treatment. Do we need to write that one or not? Okay, that means you can just mention the medical thing because yeah, the social worker can understand these things, but just do in a superficial manner, okay? Not in a deep manner, okay? So maintain psoriasis treatment. So we can just club that information with the psoriasis medications, isn't it? Okay, so maintenance of low GI diet for diabetes. Again, the same thing because we know that the patient is now diagnosed with diabetes as well. So you should mention that well in a separate point and club with that information. So we can put that information with the diabetes. Okay, encouragement in social sporting activities. That's why lawn bowls is important now. Okay, so this we just categorized all the information into three different categories like relevant, semi-relevant, and irrelevant. So our point is you got only 45 minutes to do all these things and how you're going to do it and how you're going to plan it and how you're going to write the letter. And these all are in a note form and you need to transform it into a sentence. And you need to be, that sentence needs to be in a well, structured manner. And the paragraph should be continuously following after each other, like it should be a connected one. So there should be some planning before you are writing the letter. Okay. And another important thing is that you need to be organize your letter as well. So when you see here the writing assessment criteria, is everybody is able to see this one? Okay. So we already said that the letter should have an introduction first. That introduction should contain what is the diagnosis of the patient or present condition of the patient and what is the exact purpose of the letter. Okay, what the receiver has to do for this patient. Okay, so that's why the purpose of the document is immediately apparent. And the second one, we already discussed that sufficiently expanded means the introduction. In the introduction, we said that something has to do for this patient. So the next paragraph should be why the patient required that care. Okay, so that is the answer in the first paragraph. While if you are the receivers, then you are going to have that the same feeling. So if you read the introduction, then you will look for why I want to give this particular care for this patient. Okay. And another important question in the case note, where it is mentioned it is an urgent or not, and why it is urgent. Okay, it is mentioned in the writing task that it is an urgent letter. So where you are going to mention that it is an urgent letter. So you should mention that urgency of the letter in the introduction itself. Okay, because when you read, if you are the receiver, if you are the social worker, then you will know that when you read that introduction itself, okay, I need to look after this patient urgently. This is an important case, isn't it? So 3 points, if it is an urgent one, so you have to mention that urgency of the letter in the introduction itself. So when it comes to the urgency of the letter, you have to mention that in the introduction. 3 points. One is what is the condition of the patient, and second, what is the purpose of the letter, then the urgency, whether the letter is urgent or not. Okay, so that is your introduction. Then why the patient need an urgent attention is your first paragraph, because the patient was admitted because patient had an attempted suicide overdose of. Yeah, so you have to mention. So then your story is like you are telling a story about that patient and what happened with that patient and what is the social history of the patient, because you are going to write a letter to the social worker. So you're mentioning the patient is have an addiction with gambling and he is in debt. Okay. So that should be your first paragraph. So here, because you are going to write a letter to the social worker, the social history is important. So in that social history, patients, the priority is going to gambling addiction and depression related gambling addiction. So when you're talking about the gambling addiction, you should club informations like he began gambling 2 years ago. After, you can, when it considered retired 2 years ago, we put it as semi-relevant. Club that informations with that 2 year. Have you got an idea now? So this is why he started gambling. So after the retirement, he started gambling. You can club that information. That means they put that two different views. It is already given in the first social history, and somewhere in the later in the case note, it is given that began gambling 2 years ago. Both is you can club, that is you have to find that relation between the case note. Okay, so then you can see that gambling again began 2 years ago, then debt. Okay, so then that's why a suicide attempt was done, and now he is ashamed of his condition, so he want to overcome the gambling addiction. Okay, so then you said that story, you finished about the gambling addiction thing. Then you are going to talk about his social history, just about the social history, how he lives. He lives with family and what's his condition. Okay, or is he smokes, or is he drinks alcohol? That also comes under that social history thing. Okay, R- write it as a separate paragraph. Don't club it with the gambling addiction. So, because that is the main point of your story, that you presented it as a well planned one in the first paragraph, then you're going to write the less priority wise, you're going to write in the second paragraph, this is the other social history regarding his, the social history, or you can say another thing about his, yeah, you can directly say about the social history. So this all the patient is lives with a family, and son is, if you want, you can write about the debt, and or you can talk about he regular social drinker, and about, I think, if patient has cigarette, yeah. See, it's mentioned heavy smoker here in past medical history. So, but it's not actually a medical history. It is related to social history. So they are going to mix all the informations. Even they are putting a subheading here. So that is make you, so it's a tricky one. You should be very aware of that. It is not exactly the past medical history, but you have to find out which one is medical history, which one is social history, and you have to separate it and find out which is relevant, find out which is semi-relevant. Then you are going to write your letter and present it like this, like the important informations you are giving in the first paragraph, then the second priority wise the social history, because social history is still relevant because you are going to write the social worker. So then again, you are going to write what are the informations you are going to write in the next paragraph after the social history. Of course, discharge plan, but before that, yes, of course, you have to say that what you have done while the patient in your hospital. So the first thing you said that the patient's social history is like patient had an attempted suicide overdose of mogadol, and then you said, oh, somebody is trying to join at the moment. Last, okay, so just admit them and keep going. Okay, so Patient is patient had an attempted suicide overdose of Mogadol. That is the diagnosis in this case. So that's why the overdose of Mogadol or why the suicide attempt, because of depression related to gambling addiction, which started the gambling started after his retirement, and he lost all his the superannuation funds, and he is in debt. That's why he attempted for suicide. So after that, he can say that he is currently ashamed of that situation and he want to come out of that. Yes. So if you said that about all that information, the reader will get, okay, that's why the patient had an attempted suicide. So I need urgent attention. Is that clear or not? Okay. So after Okay, that's fine. The next one, the social worker, you're going to write the social worker, less priority social information like patient is, like lives with family and son is unemployed and wife works at course. You can mention that if you want, and otherwise, heavy smoker, underweight, all that information. Underweight, you don't want to mention, you can consider it as later because when we talked about the um, when we are going to talk about the diet, then you can mention underweight and BMI at that point of time. Okay, so you should club the informations in, the it's a kind of medical information given in the past medical history. Okay, so like that you have to club. So the second point, the second body paragraph, we are going to talk about less priority social informations like smoking, or drinking alcohol and lives the family situation and all. After that you're going to write what happened when the patient in the hospital. Okay, so what you had done, you had done, patient was depressed and all this medication was done. Patient's medical history now is important. So you can mention that patient had what? Bronchitis is already there. So that is previously there, and patient had bronchitis or diagnosed with type 2 diabetes now. Okay, so diet, when it comes to diet, you should remember there is some point is already missing there. That is semi-relevant information. That is patient is underweight and BMI is 18. So you have to club that information. So that is your third body paragraph when you're talking about all the medical conditions and what you had done while the patient is in the hospital. Okay. So, so all this is done when what is the next thing you're going to say that why the patient need follow-up care. You're going to explain it like the patient need encouragement with medication. So if you want, you can club this information with the third paragraph while you're talking about the antidepressant medication as well as other medications for the see here it is antidepressants low 1 200 mg and BP is there and diabetes was regular diet and oral medications. They are talking about that one. So you can mention that. Okay. So you can club that informations with the encouragement of the medications, antidepressant. When you're talking about Lovan, so you just mentioned He needs encouragement for his oral medication. Just finish that point that time itself. Then you don't need to write it again in the conclusion. Okay. Then when it comes to next point, that is diabetes, all that, when you're going to talk about diabetes, think about diet. If you're talking about diet, link it with the patient is underweight and needs attention for the diet as well, and mention that patient's BMI is 18. Okay, so that is finished there. When you're talking about psoriasis, again medications are there, so he can what he can write. So is there anything needs to be maintain psoriasis treatment? There is a point here that we already, so it's all there in your discharge plan. Okay, so he needs to continue his treatment with psoriasis with all that medication needs to be continued. Just one sentence needs to be continued. That it's finished. So that's all in the third paragraph. Why we are doing that? We have some other important things to ask to the social worker to do. What is that? Yes. Mm-hmm. So he needs to be joined in gambling addiction action group. Okay. So encouragement to do that. Even if you want, you can club this information with the first paragraph itself, or you can write it in the last paragraph separately. No worries in that. Okay. So the important thing, but you have to mention that three important points. Like one is this. Okay. The another one is we need to arrange an over wheelchair because that is the task of the social worker. Even if it is less important, you need to tell that, isn't it? Then again, encouragement for sporting activities. So these 3 points you can conclude your letter. All other can club in the letter before itself. Have you got my point now? Is it clear? Okay. So this is why you are going to write a good letter. So when you are presenting like this, so when you are going to read your case note, then you take each point one by one and differentiate like this and find out whether it is there is a connection or not. So then only you can write a good letter. Okay. Then again, one more point. So when it comes to um, planning, so the first 5 minutes you read this letter. Next 5 minutes, take your pencil and do what we have done now. Find out it. Don't worry about your time. Do it and plan which one is your introduction, what you're going to write. Just think, okay? Frame an introduction. Then move on. Again, don't going to write now. Don't write until you are going to finish your letter in planning session. Okay? So you have to plan. This is my first paragraph because that is important in this case, gambling addiction. Okay, so that is important. Why we are going to write this letter? Because of patient attempted suicide because of gambling addiction. All these things is depression, gambling addiction is related one. That is my first paragraph. My second paragraph is going to write is social. The next one is social things, less priority social informations, and think and plan and organize that. Next one, I'm going to talk about what we had done to the patient in the hospital, like with the medical history included in that letter, and what you are going to link some of the discharge things with that paragraph itself. So you're going to do that. Then this is my conclusion. These 3 points I'm going to conclude, and I'm telling that this needs to be done from the service from the social worker. So when you done that point, start writing. No worries. Maybe it will take total of 12 minutes time, but when you are going to do like this, your writing will take only 15 to less than 20 minutes time because you already done your letter. You are just writing what you had planned. Okay, there is no confusion. You didn't miss any of the information. You know that you planned it well, and organization is there is a connection between each paragraph and it is flowing correctly. And when you're going to finish that letter, so just you're going to finish that letter before the stipulated time, that is 45 minutes. You're going to finish at around 40 minutes. So you got 3 to 5 minutes. I'm sure you will get 3 to 5 minutes for to read your letter. So at that point, as I already told you in the last class, that you are going to be the receiver. So now, when you are reading the letter at the end of your writing, you are the social worker and you should think like a social worker and you are the receiver. You got that letter right now and how you are going to perceive the informations in your own letter. When you read in that view, then you will know that, oh, this is not right because the social worker don't want this information. I don't want this information. Or you will think that, okay, this is apt because it's saying all the information correctly. And again, while reading, you just go for the small technique, that is PT scan, that we already discussed. So it's punctuation, tense, the subject, verb, agreement, and capitals, articles, and numbers that you can check quickly in 2 minutes time, and you can finish your letter. So just done. Keep it your letter ready and out of the examination hall. That's it. Is any case note in any sense, you are going to write it. So what we need to do, this is actually you're going to write in your IED examination. So the next step is, while you are implementing these all ideas, you may have trouble to write the exact sentence. So sentence structure, sentence correction, and you may need some, some more ideas related for your, implementing, or how you want to write the exact sentence, the connection between the sentence and organization. Maybe you lack the exact organization, what the receiver is looking at. So that's all we can give you when you are going for the further classes. Okay, that's the only thing I can tell you, because this is all about writing a letter, a good letter for your exam. Okay, is that clear with you? Okay, so that's all about our class for today, and I hope you all understand and you all, um, happy with our class. And we have, as this is, that's why this purpose is going on, like it will end within 1 or 2 weeks time, the free sessions. But the thing is that we have many candidates before as well, so all of them got in writing, so they usually comes for writing correction services. And we have individual classes, that's like you're going to write a letter, we are going to provide the case notes. Whatever the case note doesn't means anything, it depends, because you are not going to see any case note that you are already seen. You're, that is not you will get an exactly different case note in the exam. So we will provide a case note and you have to write a letter. We are going to discuss that letter for 1 hour. That is our individual sessions is meant to be. Okay. If you want to subscribe that for, you can message us in the group, then probably we can help you with that. And uh, please please share this to your friends if you want, like if you are interested, or you just tell them to join with our group as well. That's the only thing we are expecting from this another session, free session. All right, thank you all for today. Yep, thank you.